Councillor Van Alphen, are you with us? Thank you. Councillor Patton may be a few minutes late. So I will call this meeting to order. It's 1 o'clock. Beginning with, this meeting is being recorded live and is streaming on the District of Summerland YouTube channel at youtube.com District of Summerland. All representations to council, whether written or verbal, will form part of the public record and be available to the public for viewing electronically or as a written record. Members of the public may access the meeting or participate in the following ways. 1, watch the meeting live or recorded. Individuals who wish to watch the meeting may view it on the District of Summerland YouTube channel at youtube.com District of Summerland, live or recorded. 2, register in advance to speak during the meeting. Members of the public who wish to provide comment during the public comment opportunities found under items 6 and 9 are asked to register in advance by contacting the corporate officer at corporateofficer@summerland.ca with the following information: your name, your civic address, and how you will be participating, whether by phone or Zoom. When you register, further details will be provided to you. 3, request to speak during the meeting. Those who have not registered in advance but wish to speak during the public comment opportunities may connect to the meeting by calling the meeting conference line at 778-907-2071 and entering meeting ID 506-489-9374 and passcode 485186. After everyone who has after I have provided everyone who has pre-registered with an opportunity to comment, the floor will be open to those on the conference line. Corporate Officer, do we have any late items to introduce?
There are no late items, Madam Mayor.
Thank you. And on to approval of the agenda. Just a reminder, Council, that there are times on the agenda. Those are considered as part of the agenda. Anyone want to bring forward a thank you? You are making the motion to adopt the agenda. Thank you. And seconder, Councillor Van Alphen, thank you.
Madam Speaker.
Yes.
I've the host has disabled my video, so I don't know why, but that's why you don't have my picture there. That's why you can't see me.
We saw you earlier. I'm not sure what happened.
Okay. I've just been asked. There we go. Thank you, whoever.
Okay, perfect. Thank you, Councillor Holmes. And now we're ready to call the question. All in favor of the agenda? Any opposed? Okay, that carries. Next up is adoption of the minutes. We have 3 sets of draft minutes: Committee of the Whole from the 19th and the 20th of January, and the regular afternoon council meeting of February the 8th. Any changes or any omissions there that need to be updated? Okay, seeing no hands raised, could I ask for someone to bring forward the adoption, please? Councillor Van Alphen and Councillor Holmes, all in favor? Great, thank you. We don't have any delegations on our agenda this afternoon, so we'll go right on to the public comment opportunity. I don't have anyone on my list. Do you have anybody in the meantime, Karen?
There's no one on the line, Madam Mayor.
Okay, thank you very much. So moving right along to the business item 7.1, the Summerland Community Recreation and Health Center, the proposed primary health care center component of that. And I will pass this over to our CAO, Graham Stat.
Well, thank you, Your Worship. Happy to introduce the item. Council will recall that at the February 8th meeting, the recreational components of the project were considered. It is the focus of this meeting item to consider the primary care center contemplated in the original concept. Attached in your package are the results of the needs assessment as well as a business case. And recent examples of feasibility studies from both the Soyuz and Lake Country are also included. You'll see from your report that an estimated 4,000 residents of the district will be without a medical home in 2021. It'll be our recommendation that a separate feasibility study be conducted for the healthcare study, and that also we include the healthcare center and the site fit study associated with the recreation and aquatic center. I would note that we are joined today in the Zoom meeting for this portion by several members of the primary care professionals in the community that we've been working with on the steering committee. They're present to hear discussion, but also, of course, could be called upon if council has any questions or requires clarity. And with that, I'll call upon Lori Mullen to talk us through the presentation. Thank you.
Thank you, CAO Stat. I'm just getting screen sharing here. Can everybody see that okay?
Not sure why I can't see it.
You can't, Madam Mayor, you cannot see this presentation?
No, no, I can't. I can follow along in the notes though, in the agenda package.
Can others see it?
I can see it.
Isn't that odd?
I can see it.
Okay.
Okay. Could you hold just a second, Lori? I see that Karen's come in. I'll just put my mask on. Usually it shows up here. Okay, I think you can go ahead now.
Okay. Thank you, Madam Mayor.
Thank you.
Okay, staff attended the February 8th council meeting to receive direction for the aquatics and recreation component of the Summerland Community Recreation and Health Center project. The purpose of this council report is for staff to receive direction on the proposed primary healthcare center. I would like to acknowledge that Tracy St. Clair from the South Okanagan Division of Family Practice is in attendance of this meeting today, and she is available to answer any questions that council may have, as well as we have local physicians, Dr. Van Catamaran, Dr. Krabby on the line, and I believe Tanya Osborne from Interior Health will be joining us as well. As per the Summerland Community Recreation and Health Center Needs Assessment Report, which was presented to Council on January 25th, the consultant said that this primary healthcare center appears to be a strong need in the community and is supported by residents and local physicians. This project does not necessarily need to be connected to the replacement of the Summerland Community Recreation and Health Center as it relates to construction, funding, or timing. Based on this, it is recommended to link the primary healthcare center and the Summerland Community Recreation Center projects only if there is funding support specifically for a co-located project. Also, there would need to be a site large enough to accommodate the co-located project. According to the public online survey and stakeholder questionnaire, the most important desires for primary care center includes timely access to medical services with less wait time to get medical appointments, convenient access to walk-in clinic for minor medical problems in Summerland, that every Summerland resident has a family doctor or nurse practitioner based in Summerland. They have an access to a wide variety of healthcare and wellness services, including physiotherapy, chiropractic, massage therapy, mental health supports and counseling, addiction treatment, nutrition, and others is available in Summerland. And that it is a convenient location in downtown Summerland. An excerpt from the needs assessment report of the primary healthcare center is provided in attachment 2 of the council report. And I trust that council's had an opportunity to review this document, so I won't go through all the details, but the following information was included in this document. The benefits of bringing together different services and practitioners, the current access and barriers to healthcare services in Summerland, stakeholder key points, the current healthcare challenges, the benefits to locating a primary healthcare clinic and a recreation center together, and the benefits and challenges of investing in a municipal-owned health center. The needs assessment report indicates that there is cautious support for a primary care center and recognition of the need for improvements to healthcare access in Summerland. The public online survey showed 23% of respondents support significant district taxpayer funding and 37% support moderate district taxpayer funding. And 50% of the respondents in the stakeholder survey support district investment. The consultants identify 3 variable strategies that could be employed. The first one, co-location and simultaneous build. This strategy carries the most risk, but may also attract the most positive attention for grants or cost sharing from other sources. This strategy results in a comprehensive, attached and co-located health and wellness facility offering recreation and health together. The second strategy is co-location and a phase build. And with this strategy, the Summerland Community Recreation Center would be designed to accommodate a future co-located primary care facility. This limits the initial risk to the core project and leaves the option for future expansion available. There may be less momentum from alternate funding sources for a phased approach, but this could allow the primary care portion of the facility to remain an option until funding is secured, perhaps after the Summerland Community Recreation Center is completed. And the third strategy is not co-located. The consultant noted that downtown Summerland is a walkable community with relatively convenient access to the entire town center. Based on this, most of the benefits of proximity to a primary care facility and the Summerland Community Recreation Health Center can be realized without actual co-location. This option separates primary care and recreation projects completely, reducing capital cost and risk. The District of Summerland could, over time, continue to consider whether the municipality is motivated to build a primary care center or rely on more traditional models outside of the municipal effort. The consultants identified 2 benefits to building a combined Summerland Community Recreation and Health Center as part of this project. Firstly, the new facility would be a model health and wellness facility, allowing for some synergy among the program parts. Secondly, it may allow for some attention from grant sources and government funding to supplement capital costs. A subcommittee of the Project Steering Committee have been meeting to gather additional information around their vision for a primary healthcare center in Summerland. A Summerland healthcare business case has been provided in partnership between Summerland Physicians, South Okanagan-Similkameen Division of Family Practice, and Interior Health. And this document is included in the council report as attachment 3. I would like to acknowledge the hard work and commitment of this group for putting this document together. I will touch on the highlights of the document over the next few slides. The document provides an overview of what we know about the challenges of recruitment and retention of physicians and the desire of physicians to work in a team-based environment alongside other allied health professionals under one roof. Having primary care potentially housed together with a recreation and health center is incredibly visionary. This is an opportunity for Summerland to be a health and wellness leader that would attract more healthcare providers and ensure sustainable primary care into the future. The business case also outlines the benefits of supported primary care in Summerland. who reaps these benefits and the resulting outcomes. It includes the risks of building a healthcare center, including who is at risk and the possible mitigation strategies. And it outlines the risks of not going forward with a district-supported health center. The business case outlines the vision for a healthcare center in Summerland, which includes a 12,500 square foot space dedicated to healthcare delivery in Summerland, adequate room to be a medical home for all Summerland residents, housing 16 family physicians or nurse practitioners providing team-based care with nurses and allied health professionals, space to accommodate visiting specialists and interior health specialized services. And it notes that it's proposing that the building is owned by the District of Summerland and operated by the South Okanagan-Similkameen Division of Family Practice. The capital funding plan in the business case proposes that the healthcare center building, as mentioned in the previous slide, is owned by the District of Summerland, that the South Okanagan-Similkameen Medical Foundation and Community Foundation of the South Okanagan-Similkameen are potential funding partners. The capital budget of $8 million laid out in the consultant's report is appropriate. The size and scope accommodates expected population growth for the next 25 years. And it indicates that these specifications allow for innovation and design to address the need to accommodate virtual care and other changes in healthcare delivery spurred on by the pandemic. The operation plan in the business case proposes the healthcare center is leased and operated by the South Okanagan-Similkameen Division of Family Practice, that family physicians, nurse practitioners, and interior health primary care network and specialized service staffs are included to pay the overhead to cover the lease and operating costs, and that it operates with a break-even budget with revenues covering expenses. So with that, before I go on to the next slide, which is on decisions and next steps, I'd just like to pause here and see if council has any questions from Tracy or the attending physicians on the primary healthcare center vision and the business case document, and then we can move on. Madam Mayor.
Okay. Thank you. I'm sorry, I didn't have my eyes right on the screen. Councillor Holmes, I see your hand up still. Please go ahead.
Yeah, thank you. I was just wondering if there's before all this involvement, there were any discussions with developers and why there wouldn't be any interest from the development community for building a center like this. I would think, maybe wrongly, that with a guaranteed tenant for a long-term lease, that would be quite attractive for a developer. So I'm just wondering if any developers have been talked to. Thank you.
And I will, if it's appropriate, pass that question on to Tracy, please.
Dr. Krabbe, did you want to answer there?
Sure. Yeah. Hi, I'm Dr. Margie Krabbe. I can speak to that to some degree. I was not primarily involved, but one of the physicians in my group had ongoing conversations with local, not a developer, but a local private business owner. And so there was conversations about that. So I think there have been some people who have had appetite for that. And so I think there have been opportunities, but I think it is a big undertaking. So I don't think it's that we haven't looked at some of those options. I think I would say that part of the reason was that the concept maybe of there's some other ideas as well. And part of it has to do with, and I can take some of this back, and Dr. Venkataraman and Tracy can maybe add in there, that there is the movement through the ministry of this patient care network and an idea of having collaborative clinics. I think in the case of moving forward with a private developer or a private enterprise, it would be to establish a clinic space. And so I'm not exactly sure why all of that didn't happen. I think some of it is because along the same time, we had entered into this idea of working with the district. So there has been some exploration, and that concept has been out there. And I don't know if I could actually say, so I may need some support from Morelli as to why that didn't come to fruition.
I don't mind jumping in just briefly. I haven't had as many direct conversations in Summerland, but we had been approached probably about 3-4 years, starting 3-4 years ago, that I'm aware of, by a number of developers in Penticton, and who were keen. And just like what you had suggested, Doug, it does sound like it should be a natural fit for a developer. I think what we run into with primary care is that the margins are quite low, and the overhead to cover any rent has to cover a number of things: equipment, supplies, all the rest of it. And so when you look at the business case and what really we're able to have guarantee in terms of rent, it isn't at the levels that a lot of developers, especially if they're looking to develop new, are looking for. And I think that's where really, when we start to look at sustainability and what's going to be around and being able to attract physicians over the long run, we are looking for a bit more of a stable environment. We have seen in other communities where clinics have been funded by outside sources, and the rents are pretty low to begin with, and then they creep up very, very quickly to the point where sometimes those clinics don't last. So really, I think what we're looking for in this option is something stable to provide a long-term sustainability plan for the community. Sorry, Dr. Venkataraman, I think you were trying to get in there.
Yeah, I think the both of you've covered it well. For some reason, my video has been turned off by the controller, but I'm here. So I was involved in discussions. I met with some of the pharmacists in the community because there are models in Nova Scotia, in Ontario, and Saskatchewan of where pharmacies will open up clinics for physicians. They started it off here. It hasn't borne out well for a number of the reasons that Tracy just spoke about of the lease rates tend to go up very quickly. I was involved in discussions with some local business people who look to invest in things, and 4 of them met, and it was around the time where there was some taxation changes federally, and so they were interested in them. Once those changes happened, again, there wasn't a good business case. So I think from a developer perspective, right now, it's a hard business case for what we can pay, and then from a physician perspective, what they've tried in other areas doesn't allow for secure overhead, which many physicians are running into issues with, particularly in places like the Lower Mainland.
Madam Mayor, can I ask Lori to quit sharing her screen so we could have the gallery of people? Thank you.
Pardon me, Councillor Van Elfen.
Thank you, Madam Mayor. Question through to Mrs. St. Clair, if I may. Penticton, the primary care facilities there, are they privately owned or?
Sorry, I didn't catch the beginning. You say in Penticton, are they privately owned?
Yes, please. Yes.
Yeah, so last I looked, there's about 12 clinics in Penticton under various ownership arrangements. The clinic that we've been looking towards as a prototype as we go forward is Ponderosa Primary Care Center. In that instance, it is owned by a landlord, leased by the division, and managed by the division. The tenants are the physicians. We have 6 family physicians, 2 nurse practitioners, as well as primary care network, interior health, allied health professionals, and nurses. And together, all of those individuals pay a certain amount of overhead that goes towards the operating expenses. That's a model that is resonating more and more. What we're hearing is newer physicians aren't looking to run their own businesses. Some physicians that are looking to retire don't want to run their own businesses any longer. So we're looking for an alternate model that is still respecting the independence and autonomy of physicians as in their clinical roles and seeking strong input. But we're in a changing climate where healthcare teams are expanding to just a doctor and an MOA to larger teams to include allied health. And that's where you're starting to get into larger space needs. And Ponderosa was the first clinic of that kind that we've done in the region. And it was funded under Primary Care Network dollars initially from the ministry as one-time costs for renovations that needed to take place in that clinic. Unfortunately, so far, we're the only clinic in the province that received such funding. So we are now at the point where we're looking at how to replicate that model in other communities. Went way beyond your question there, sorry.
Thank you, Tracy. Other questions? Okay, I will. Oh, Councillor Barkwell.
Thank you, Madam Mayor. Let me see if I pull it up again. I was looking, I mean, the resolution is to carry on further, and I agree with that. So maybe what I'm sort of questioning or pointing out will get resolved down the road, because I'm looking at the sort of the pro forma budget, and it doesn't have what it has things like that are kind of confusing. Like it says triple net lease, which normally includes taxes and buildings and insurance and stuff, maintenance that the tenant pays, but then it includes those things as part of the, or looks like as what as expenses of the operation. So I'm not really clear on those things, but so hopefully that gets cleared up if they delve deeper into a financial analysis. But I guess my main point is that the doctors have to pay for the use of a facility somewhere, right? Out of their billings, they pay for whatever location and space that they have, whether they buy their own building and go in it or rent from somebody else. So one way or the other, it seems like it's possible that we could provide a facility and recover our costs because and provide a better co-location than that everybody's looking for as a future. And I'm talking to many people. I agree 100% with everything what you say about this as a future. The only problem is that it should be at a cost that would be equivalent, that doctors should pay what they would pay otherwise in any other facility. And there's no reason why that can't happen, and we make that work, especially if we can find some land. It doesn't have to be factored into the equation, such as a developer would have to. And so I say yes, I like what the resolution says to go forward, but there's a lot of questions here.
Councillor Barkwell, do you have a question you'd like to ask now, or?
No, I think I'd be getting ahead of myself. I just sort of want to make the point is if we do go further, that there's things to resolve. Okay,
thank you. Councillor Van Alphen, before I go back to you, I'm just going to ask a question myself. I have a question, and it's related to the rate that Councillor Barkle was just talking about, the $28 per square foot with including the triple net. I'm wondering if that seems kind of low to me. Is that reasonable? I know that with triple net, it's typically a lower base rate. Could anyone speak to that? Like, is that reasonable?
I don't mind speaking to that from our perspective. So that is above what we're paying for Ponderosa, and that's above what we're able to negotiate in smaller existing spaces. And I think what it signals is that the overheads, the budget that you have does signal what overheads available from doctors. And if you tease it apart, what we're finding is that the overhead that's available through allied health and nursing for interior health employees is actually about a third of what we're able to raise through doctors' overheads. And it does signal that overheads in the healthcare system are not adequate, I think, to keep up with market rate. What you're competing against is having doctors come into what we call longitudinal traditional practice, an office practice, when they've got choices to work elsewhere, like in hospital or in some of the newer facilities in the larger cities, urgent care centers and things, where they don't pay any overhead and they're making an hourly rate that's probably more than they're making in these private clinics. We still are getting interest. Not everyone wants to work in that model where they're not looking after their own patients in all aspects of care. So we still are betting that the vast majority will want to work in traditional practice. I'll call it traditional longitudinal practice. But if we aren't making the overheads competitive with other areas where they can be as low as no overhead, then it's going to be harder and harder to attract. So what that $28 represents is probably the threshold of what we're looking at right now with what the market can bear. Otherwise, they can work elsewhere or stay in their small practices where they can work with less overhead. Problem is, we're not having any success recruiting into the smaller practices. So if we don't do this, then that practice will, as physicians retire, it'll be very difficult to replace them.
Okay, yeah, I understand. It's a real delicate balance. So thank you for that. That's a great answer. Dr. Krabbe, did I see you raising your hand? Did you want to speak to this as well?
Well, not exactly, but I was thinking quite loudly. I guess to some degree what Tracy's saying is that as physicians, we do have a fixed payment schedule from the government. And as a result of that, even though we are private business owners, we are to some degree enslaved to the government for our income. So sometimes really the only way we may be able to make more income is to see more patients. So we are public servants in one fashion. And so I think to some degree what Tracy's saying is the district or any community in one way may be helping to subsidize us as public servants to provide healthcare to the community. So this isn't exactly a community health center, because a community health center would be a different idea. It would have a board and we would be working specifically on community mandated projects. But by offering a fair overhead, you are trying to help to attract and retain physicians in our community. Dr. Venkataraman and I both actively work and have basically brought family practice training to the Penticton, Summerland, South Okanagan, And that is a mandate to help to bring more family practice doctors here. But for those family practice doctors to be here, there has to be some place for them to work. And so that's part of what Tracy's speaking to as well. And many of those family practice doctors are instead choosing some of these jobs that Tracy is speaking about, going and working in a clinic where they don't have any overhead, and that is much more attractive to them. So trying to maintain a low overhead and a sustainable clinic practice is a tool to have doctors continue to work in our communities.
Good. Thank you very much for that. Councillor Carlson, and then back to Councillor Van Elfen.
You're speaking of that just brought me back a couple weeks to when the midwife clinic determined they were going to close. So I do see the parallels to what you explained between the income schedule and everybody. You only make a certain amount, and all of these overhead costs that you must put into running a clinic and running you need a certain number of people, a certain number of practitioners in that facility in order to make it continue to be an option. And we know that there's already a shortage of GPs, and now they're going to have to start delivering more babies. I mean, it isn't going to get any better. And so I do believe that if the District of Summerland has the ability to improve primary health care within our community, we need to do everything we can to make sure we're supporting the healthcare professionals. So through this conversation, I think there's a lot of new information that I didn't really understand before, and I do think that I'm glad we're talking about this, and I hope we can move forward quickly.
Thank you, Councillor Carlson. Councillor Van Elfen, and then Councillor Patton, did you have your hand raised? No, Councillor Van Elfen.
Thank you, Madam Mayor. Just a question through to the doctors that are with us today. How many doctors do we have today in Summerland practicing? Would anybody know?
Morelli, do you want to speak to the details around that, Dr. Venkataraman?
He looks like he's frozen.
Sure. Yeah, he does look like he's frozen. Tracy St. Clair can fill in here, but I would say, so currently, and I would also speak to this, with some explanation of some details. So for example, at the Rosedale office, I think are now at 9, and some of those positions are split positions because some of our physicians are doing emergency room work, some of what we call the hospitalist work. So I believe my clinic is now at a 9-physician practice. In Morelli's practice, there are currently 4 physicians. And then we had another physician in our community, Wendy Richardson, but she is retiring from the community. So that would take us at 9, 13, 14. So those are our current numbers, but there is and continues to be a definite shortfall as far as the unattached patients in our community. And I know that there is a need for, I think on our estimates, which was what we were hoping to do, is to be in a 16 physician community. Now, again, many of us don't work kind of a standard 4-day week. Many of us work abbreviated weeks, but have other duties that we're doing. Morelli, do you want to speak to the number of physicians in the community and the recruitment plan?
Sorry, I lost everybody there. Can you hear me now?
Yeah.
Yes.
Okay. Yeah, I missed a little bit. My computer froze. So we have in our, so I might not have heard, I didn't hear what you said, Margie, but we have 4 physicians in our practice. We're currently trying to recruit either an NP or another family physician. And we don't really have space for them, but we're going to try and figure it out. And then Margie at Rosedale, I believe there's 9. And then our other physician is leaving. The solo physician's leaving as of March. And that's why we're going to have unopened spaces. We have been trying to actively recruit now for a while. And yeah, it is proving to be challenging.
And I would add to that, our biggest issue is neither of us have space to accommodate more physicians. And both clinics are training 2 family practice residents. So there's a first and second year family practice that rotate with each of our clinics. Divisions has offered us the capacity or the ability to take a nurse practitioner into our office, but again, neither of our clinics have much space. We are trying to be creative, and then we're operating the after hours clinic out of the Rosedale office. We do have a social worker that's part of the patient care network. She's operating in between the 2 clinics, but again, there's been a real lack of space for that to occur.
The reason I asked is that I didn't know how many doctors we had currently today, and in this building we're contemplating, you're looking for housing for 16 doctors. Is that going to be adequate? Because it seems like you're in a shortfall as it is today.
Yeah, so and that's what we sort of looked at, the capacity of where we're at now. Although we have the number that we stated here, many of us are doing other things as well. So, as Dr. Krabby said, we're involved in the UBC curriculum program. I work at Martin Street. I work at Foundry. So a lot of us are doing other things as well. So, and that's what when we look at the future of family medicine, that's what a lot of family practitioners want to be doing, is working 3 or 4 days in a longitudinal practice and then the other 1 to 3 days elsewhere. So when we projected the rooms, that was looking at future growth. It was looking at continuing.
Looks like Morelli's frozen up again there.
Continuing to teach, which I think we've projected not just for now, but for future.
Okay, other questions? I have one other question about the 3,000 square feet. I know that for some time we were talking about, 9,000, between 9 and 10,000. I'm wondering, and you can just I won't be offended if you tell me, no, that's a ridiculous thought. I'm wondering if that 3,000 square foot could be considered an addition, or does that really mess up the whole work that needs to be done around design and making sure that it's, pandemic safe and all of that?
Lori, did you want to speak to this, or do you want me to speak as best as I can to that?
Yeah, Tracy, if you can go ahead as far as your needs for square footage and
Sure.
flexibility around.
So as I understand, because I looked at that 3,000 square feet and I thought, well, that's an easy one to take off. That saves us some money. And as I understand, it is built into the calculation by the consultants as almost like a contingency, or what you'll need for hallways and corridors and all the rest of it. And so what we went back and looked through quite carefully were the projected room sizes based on how many rooms that you need. And it believe me, we tried quite hard to take some out of there. But if you are looking to build something that's going to be feasible for the next, hopefully even more than 25 years, but at least 25 years, it was hard to know what you could skimp on there. And I think if the architects say 30% is needed, then so far, like, that's what we go with. I think the other thing just to be aware of is that primary care network is in its infancy. And Penticton and Summerland were the very first communities to get primary care network staff. And we only have, I think, 7 or 9 staff in total. But we are seeing just such great experiences coming out of that. So I do think we should be doing some planning around having more allied health and nurses in the space. We just don't know exactly what those are. So when I talked to Susan Brown from Interior Health, what do you think is reasonable? She said, well, like maybe put 3 more in. So again, we're quite conservative in our estimates when we look at the operating budget, but with flexibility, and we've had some preliminary discussions about when you get in and actually design the space, making a lot of the spaces usable for exam rooms or telehealth or like a number of different things, then we should be able to really quite be creative with it.
Good, thank you very much. Dr. Van Canneran, you have a response to that as well?
Yeah, so I don't know how many of you are familiar with the mental health substance use clinic in Penticton, Martin Street. Tracy and I were involved in setting that up, and that was a good lesson in our first kick at the can at team-based care and in collaborative work with Interior Health. It quickly used up the space that we have, and we still haven't fully integrated the team, I would say, working there. And we're now moving into a bigger space. So I think, when we looked at this space, we've been working on this, with private developers, with Interior Health now for probably 4 years of looking at a clinic in Summerland. What would we need projecting forward? And I think that's how we landed on that number.
Thank you. Councillor Carlson.
Thank you. I have a question about the scope of the feasibility study. Obviously, to look at, how this might work. I'm wondering, will it also identify what are the risks if we don't put in a primary care facility? What are the risks to our community, both in terms of healthcare outcomes, but also, attraction of new people, retention of not only doctors, but also citizens. If we don't have doctors in our community, why would people come to our community? So I'm just wondering, will the feasibility study help explain some of that as well?
I can jump in, Madam Mayor? Okay.
Yes, please go ahead, Lori.
Thank you, Councillor Colchlin. Absolutely, it can be included in the scope of work. In the last slide, we've got a breakdown of what's included or proposed to be included in the feasibility study, which I can go through in detail if council would like, but certainly having the risks of not going forward and what are those corresponding impacts to our community could be included.
Thank you. I just asked because I know sometimes we forget to tell the whole story, and I think it's important that if we decide not to do it, we know what the risks are in not doing it as well. So, thank you.
Councillor Van Elfen.
Thank you, Madam Mayor. Just a question, if I may. Is our old hospital being fully utilized, square footage wise? Does anyone know?
So, sorry.
Please go ahead.
Yeah, Councillor Van Elfen. So that was actually one of the places we looked at with where we came up with the square footage. We went back to Interior Health. Susan Brown was involved. Lori Motluck was involved, and we took it back and learned. So we had a proposal for renovating that space, but the costs, it is such an old building, and the costs of bringing it up to current health standards made it unfeasible.
Thank you.
I also understand really that there just wasn't the space without displacing some pretty valuable services. And there was no alternate plan for those services as well. That's
right. Yeah, we would have had to give up all the day surgeries would have had to go to Penticton. So cataracts, things. So that would have been a significant impact. Thank you, Tracy.
Thank you.
Council, any other questions before we carry on? Okay, we're looking at, Councillor Van Elfen.
Just one more, if I may. So I can see the value in this. I understand. I've read all the reports. It makes sense to me. If it makes sense to me, then why isn't IH cutting a check for the building? Sorry, it's maybe a dumb question, but can somebody answer that for me? We know how vital it is. Obviously, they've cut some checks in Penticton to make it happen.
Okay, let's give them a chance to reply. Okay.
Thank you, Madam Mayor.
I think we need a politician to answer that one. I'm just joking. So the Penticton one was actually funded directly from the ministry and under the primary care network funding. And so the funding flowed directly from the ministry to the division, and we put that project together. I think it's fair to say that funding of primary care clinics is probably top of many people's agenda in ministry as of now, and we haven't seen anything coming out around funding for clinics outside of what we are seeing as urgent primary care centers, as well as what Margie talked about, community health centers. And those are quite specific models and with very limited numbers. So urgent primary care centers we're tending to see in more of the larger communities, and community health centers, pretty early days for those. So I'm not sure. I think there's, I know of one up north that's First Nation focused, but we haven't seen a lot of those develop yet. And one of the living in a rural setting, and I would say that even Penticton, we're more rural, we aren't seeing the same opportunities yet, though I'm quite certain somebody's got to be addressing that down in Victoria. We just haven't seen anything come on the radar. What we are seeing is there are some communities that figured this out about 3-4 years ago. Sydney Saanich, I think we've probably talked about before, called South Island. They've done a lot of work to have, our model is based on their model because they're able to, we looked at who was attracting the most doctors, and they were. And so they have a society that runs clinics, and down there, their medical foundation, and I believe their hospital district put money in every year, and they just kind of renovate building after building. And we also have seen a similar, a community getting together in Gabriola around a clinic where they just had visiting doctors, and now they've got, I think, 3 doctors that fight to live there full-time and doctor there. So again, not sure where this is going in the future, but definitely don't want any to lose the doctors that we have, and won't be able to recruit more in the meantime while those bigger answers are coming.
Okay. Are we ready to carry on with the presentation? Okay, please go ahead, Lori.
Thank you, Madam Mayor. I'm going to share screen again. Okay, does that look okay, Madam Mayor?
Yes, thank you.
Okay, so I'm just going to advance the slide. Here we go. So moving on to decisions and next steps. Staff require the direction of council on whether further analysis should take place regarding the creation of a dedicated new space for a primary health care center at the district's expense. If council would like further analysis to be conducted, it is the recommendation of staff that a separate feasibility study be prepared for the primary health care center, including whether it could be adjoined to the recreation portion of the project or separate, and that the primary healthcare center concept be added into the site fit portion of the existing work already planned to understand whether the proposed locations can in fact accommodate the space envisioned. So that would be on the existing site of the Summerland Aquatic and Fitness Center and also looking at the arena site. The draft 2021 financial plan includes $100,000 for the next phase of work for the Summerland Community Recreation and Health Center project. It is anticipated that a separate feasibility study for the primary healthcare center can also be achieved within this budget. However, Council has already indicated that the potential renovation and expansion of the existing facility should be explored, which will add pressure to this budget. And then just in closing, a municipal-owned primary healthcare center is a very new concept. The District of Summerland could be an innovative leader in health and community care by being one of the first municipalities to build this partnership. And the staff recommendation is outlined here, that Council receive the Summerland Community Health Center business case document as presented by the Director of Community Services on February 22nd for information, and that Council direct staff to conduct a primary healthcare center feasibility study separate from the aquatic and recreation feasibility study, while including the primary healthcare center and the site fit study associated with the proposed aquatic and recreation facility. Thank you, Madam Mayor.
Thank you, Lori. Councillor Carlson.
Yeah, just a question on that. Would a feasibility study also then show other potential locations for a primary care center?
Thank you, Councillor Carlson. Yes. So as far as what would be included in the feasibility study, we would build on the work that's already been have already happened so far, which is community engagement, the needs assessment, the requirements and analysis and costing as far as what space is needed, the business case document. So it would look at exploring other site locations and properties for a primary healthcare center. That would be potentially for a new build or possibly renovations, and looking at district-owned spaces as well as maybe private buildings that might be located in town and might be for sale. It would determine the Class C cost estimates on shortlisted options, sourcing capital funds from outside sources. So that could be through the South Okanagan Similkameen Medical Foundation, the Community Foundation of the South Okanagan. I think we should still be looking to the Ministry of Health for potential funding. So that would be part of the feasibility study. And determining the necessary funding contributions and methods to obtain electoral approval, if we're looking at an approximate $8 million facility. Confirming the project partners and roles, exploring potential lease agreement and operational governance model. And it is proposed that we would work very closely in collaboration with the South Okanagan Division of Family Practice, with Tracy and with the local doctors. And we're looking at a target timeline that is to have a primary healthcare center built and ready for occupancy in approximately 5 years from now, which would align with the current commitments of our local physicians. Sorry, that was a long-winded answer to your question, Councillor Carlson.
This is good. This is the slide I was looking for, so thank you very much.
Other questions on this final piece? I have one. Oh, Councillor Holmes.
Yeah, I guess the way I look at it is, you know, there's a lot of things we already know. I mean, the term feasibility study kind of scares me a bit, because I think we know it's feasible. I'd like to see a business plan. You know, we know we can't recruit family doctors in the current model. We know we're losing doctors, and you know, my family we lost our family doctor when Dr. LaBelle retired, and after some time we were attached, but we were attached in Penticton, and that's what's happening is when people are attached, they're being attached to doctors in Penticton, and my fear is that if a UPCC is built in Penticton, that's you know, that's kind of it for primary care in Summerland. So I really see this as something urgent, and I would like to. So my question is, what is the process for getting this done as quickly as possible? And you know, I think co-location, it's a nice idea, but is that going to delay? If we just kind of get rid of that ideal, will that speed the process up faster? Can we move ahead faster at all on this? I just see we can proceed with an APP. We can, if we can have some rent, pay off the debt, it won't be as such a big burden to the taxpayer. So I just wondering, what is the quickest process for doing this to get this done?
I'm not sure who should be answering that one, but Lori, I see that your mic is off mute, so go ahead.
I guess the question might be, how fast do we want it to happen? This timeline would align with having what I would project a feasibility study done at the end of the year, which would be end of this year, which would be similar to the other project with recreation and aquatics. So it could potentially come together at that time if it made sense to come together on the same site and to be co-located. But it will also, as we're studying it separately, determine maybe there is a better solution or a different site that makes more sense from a feasibility standpoint. As I previously mentioned, the timeline that the Division of Family Practice has brought forward to us as an ideal timeline would be 5 years from now. But Tracy, if you can speak to whether you think there is an advantage in our community to go faster than that, or given all the moving parts, it might take 5 years to get to a build completion. But Tracy, I'll pass it over to you as far as timelines.
Thank you.
Yeah, I find that getting the timing right on something as big as this is not that easy because you are looking at moving a whole bunch of people at the same time, and they do all have existing commitments. And I think ideally if we had done it this year, that would be just ideal, but we missed that boat. And so I think the next window is probably around, ideally, again, 2025. What you risk there by deferring it is not being able to recruit new physicians to the extent that you want to. What you gain is you're going with a natural momentum that's already happening and is in place. And it does give you time. I know that we opened Ponderosa in, I think, about 4 months turnaround, 2 months after the fires ended. We only had 2 months in there to renovate. It was an existing clinic already, and we had plans for it, but so the renovations were minimal, but it's an awful lot of moving parts that you're putting together. So I think if we had a mutual target date of probably 2025, which 4 years or so, 5 years at the very outset, it might be good timing and it might be realistic with the scope of a project this large. So I don't know if somebody else, Marley or Dr. Krabbe, if you want to speak to that.
Well, I can speak to that for a portion of that. As Tracy was saying, unfortunately, some of this is a commitment for my medical practice. And this is part of the area probably where, we as physicians bear risk because being a larger group and also with this transition occurring, but we have lease commitments in our current practice arrangement, and that lease commitment had to occur this year, and it's a 5-year commitment. So sort of like this either had to happen or was going to have to happen, or we would have to commit for 5 years. So, this was when we talked about, we looked at our thing where we looked at what's the risk community, what's the risk to council. The flip side is what's the risk to us as physicians, that to get 8 physicians to agree that, yes, we are going to change our business model, which is that we're now going to be under contract with divisions. That's a new model for us to work, and on contract with them, and that we all agreed, yes, we're all in, because I know that was very important to council. Are all the physicians in that we're going to change our work model, but we had to proceed with our lease with our current landlord. Otherwise, we were going to potentially be under a risk of a raise in our rent, or and so that's our position we're in right now. So we're sort of in a difficult situation. If the project could go forward more quickly, then we're going to be in a position where we would have a situation with our lease of potentially having to buy out our lease or make some other arrangements with our lease. So again, we're kind of trusting the process and hoping, depending on how it goes forward, that we would sort something out. But our best situation right now is that a 5-year timeline. I don't think we're against something happening sooner, but we do have that contractual obligation.
Thank you, Dr. Murley. Dr. V?
Yeah. So Councillor Holmes, that's a really good question and thought of the urgency. Even if we were to have a plan and start today, like generally builds like this are a couple of years. Tracy said it well, that in order to pay the lease for a new building, so to pay municipality to cover the costs, we all need to move over. We did look at the option of moving over as our leases ended, moving over. But then that affects the ability to pay, because, in order to cover the cost for this new building, we need to have it full and we need to have everybody in there. I think, but on the other hand, we need space to bring physicians in. And if we're going to wait 5 years, we're going to try and squeeze one more into our clinic somehow. But yeah, so I wonder if the answer to your question is, if as part of the feasibility study, we look at, well, it's important to do this properly and to not rush it and make mistakes. But what if, as part of that feasibility study of going, okay, if this was to be done in 3 years or 4 years, what would that look like? And how would we work out the financial components of everybody moving over? When would they move over, and paying lease to municipality? So, could that potentially be incorporated into the study? And that Lori might be able to answer that.
Thank you, Dr. Van Catamaran. I like that idea. We can certainly write in what a transition plan could be as part of the feasibility study, and having discussions with the local physicians and interior health, and map out a plan on how that could happen.
Councillor Van Elfen?
Thank you, Madam Mayor. Back to what Councillor Holmes was talking about at the very beginning of this conversation was, and I don't want to count that out. I still think there is, a possibility of private enterprise out in our community. There's some big projects coming ahead of us here, I hope, in the near future. And maybe one of those projects might be interested in putting in a facility like this. We don't know. I'd like at least, council to, do some not soul searching, but, pounding the sidewalk, so to speak, and see if there is interest out in there from the public sector. And, I just don't want to count that out. Thank you.
Okay. Any other questions? Councillor Patton?
Thank you, Madam Mayor. Kind of tailgating on what Councillor Van Elpen was just speaking of. Perhaps one of the other things that we can look at is where the municipality actually looks at the land and private developer looks at doing the building. That way, it would relieve us of a little bit of fiscal responsibility and but still be able to work within or work with the family practice in regards to having their space, but would then give us the opportunity of moving forward, but more like in a P3 opportunity where we partner with the family practice and we partner with a private developer and to move it forward. So, but then again, that would probably come through more during this feasibility study. And so if that would even be a possibility there, but yeah, so I kind of like what the direction that Councillor Van Elpen was just going. Thank you.
Do you have a question, Councillor Patton?
Oh, no, comment.
Yeah, okay, okay.
You're on mute, Madam Mayor.
Oh, thank you, Erin. I have one more question and then we'll wrap it up and then we'll go on to the resolution or the proposed resolution. My question is if, Tracy, I guess this would be directed to you. Am I correct in understanding that there is ongoing work on your side? I know that there is on the district side, working with either the First Nations, Penticton Indian Band, or I guess the First Nations Health Authority, to have another, voice in this.
We work with the local bands through Primary Care Network and a number of other initiatives. And so they are aware of the clinic space needs in all of the communities, including their own. So, yeah.
Okay, good. Okay, so we have a couple of recommendations here brought forward by staff. Anyone interested in bringing these forward? Councillor Holmes?
Yeah, thank you. So I'll move that council receives the Summerland Health Center business case document as presented by the Director of Community Services on February 22nd for information, and that council directs staff to conduct a primary health care center feasibility study separate from the aquatic recreation feasibility study, while including the primary health care center in the site fit study associated with the proposed aquatic recreation facility.
Thank you, Councillor Holmes. Seconder, Councillor Carlson. And further discussion on this? I'll call the question. All in favor? Any opposed? Okay, that carries unanimously. Thank you. Thank you so much for taking the time out of what I know are busy days for all the three of you. So I very much appreciate this update and answering our questions. And you as well, of course, Lori. You've always got our back. Thank you so much.
Thank you, Council. Thank you, Madam Mayor.
Okay, we're just a few minutes over, but we're doing pretty good. So now on to 7.2, Corporate Energy and Emissions Management Plan. And I will go to our CAO for introduction on this item.
Thank you, Your Worship. Council will recall that Summerland is signatory to the BC Climate Action Charter. And this requires annual reporting, but also requires making efforts towards being carbon neutral in our operations. In order to inform the updated corporate plan, a series of ASHRAE Level 2 energy audits were conducted, as well as a Green Fleet report. Based on the results, we're recommending corporate emission reduction targets of 25% by 2025, 35% by 2030, and 80% by 2050. Our intent today is just to place the report before council and to answer any questions and then to make any changes necessary, with the intent of placing the final report before council at the next regular meeting on March 8th. We have with us today representatives from the Community Energy Association, Peter Robertson, and Dale Littlejohn as well, to support the discussion. And now I'll turn it over here for further discussion. And I believe Chris Johnson, actually, I think we have perhaps Karen going to talk this through with some support possibly from Tammy if she's on the line. Or are we just going right to the consultants, Karen?
We're going right to the consultants if Peter and Dale are available.
Yes, hello. Good afternoon.
Hello.
So I'll lead the presentation, and Dale might jump in for a question or two, and also depending on the nature of questions, and I may also ask for Tammy's support with a couple of slides as well as I go through. So I'm just going to start sharing my screen, and please let me know if you can see it. Okay, can everyone see my screen?
Yes.
Okay, fantastic.
Okay.
Okay, so I'm presenting today on Summerland's Corporate Energy Emissions Management Plan, or the CEEMP. So you may recall that Summerland had an old corporate energy emissions plan, which was revised a number of times, last revised in 2010. And funding was received from the Federation of Canadian Municipalities to update both the CEEMP, the Corporate Energy Emissions Plan, and also the Community Energy Emissions Reduction Plan, which of course you Council adopted about a year ago. Of course, the pandemic, the reason for the delay with bringing this particular plan to council has been because of the pandemic. So Summerland has a goal of reaching milestone 5 in FCM's Partners for Climate Protection program, or the PCP program. And you've also received support through SFU's, what they call the ICABICI, or Integrated Climate Action for BC Communities Initiative, for applying a low carbon resiliency lens. What that does kind of applies both a bit of an adaptation lens onto mitigation actions. And of course, as a bit more context, so Summerland is a climate leader. So this is something received from the province of BC in 2018. It was referred to as a climate leader, a BC climate action community. So now, just as a reminder, now you will have seen this a number of times before, and you saw it, for example, in the presentation to council for your community energy emissions reduction plan. So there is a 5 milestone framework through the Federation of Canadian Municipalities, the Partners for Climate Protection program. Summerland wants to go through all 5 of these milestones. These plans will take you through the first 3, which are basically inventory, targets, and a plan. And that's basically what that is. And then 4 and 5 are basically implement and then monitor, just as a very quick summary of what that is. You've seen this a number of times before. And also just as a reminder, that climate action can be looked at from a mitigation lens and an adaptation lens. And both of these plans, they're primarily focusing on a mitigation lens. In other words, reducing the impacts that Summerland will have with respect to climate change. So reducing its footprint. Now, adaptation is something that the SFU team, which has reviewed both of the reports, is primarily looking at trying to include aspects of adaptation into the mitigation actions. And also Summerland has a long-term plan of looking more at the adaptation side of things. So what are your risks and vulnerabilities from a changing climate? So which is of course a very important part. Well, they're both very important parts, both the mitigation, your own footprint, and the adaptation piece. So what are the reasons for a corporate energy emissions management plan? Well, Summerland is, of course, as the CAO just said at the beginning, is of course a signatory to the Climate Action Charter, as the vast majority of all communities in BC are. of all local governments in BCR. It helps to operationalize OCP policies and council priorities. It supports other District of Summerland plans, for example, the Community Energy Emissions Reduction Plan, or the CERP. Also your energy strategy that your utility has. Helps to provide healthier and safer indoor spaces, both for employees of the District of Summerland and also for people that use your spaces as well. Helps to lower costs and reduce risks and vulnerabilities. And I'm going to refer to that a number of times in this presentation. Demonstrates leadership in reducing your own footprint, and therefore, helps to stimulate action in the rest of the community in terms of reducing your footprint, and can also assist in accessing grants and rebates into the community. So the piece about lowering costs and reducing risks and vulnerabilities is kind of summed up there a little bit in the blue box. And it is going to be a bit of a recurring theme in this presentation. So the District of Summerland spent about $1.2 million in its corporate energy expenditures in 2018. And that's roughly a 20% rise from 2012 to 2018. Your energy consumption is broadly the same as it was 2012 to 2018. Your greenhouse gas emissions are actually a little bit lower than your all-time high, but your energy expenditures are at an all-time high. And that's basically because the prices of energy, well, they fluctuate, but in particular, electricity has been increasing. So this is something, by implementing this plan, you'll reduce your costs and you'll also reduce your risks and vulnerabilities to fluctuating and rising energy prices. So this is from SFU, again from that ICABICI program, the Integrated Climate Action in BC Communities Initiative. And just to kind of emphasize a lot of different synergies and co-benefits from implementing the kinds of actions we have in this plan. You will have seen something like this before, but I'm not gonna pick out all of these, and not all of them are relevant either to a corporate plan, but a number of them are. So for example, cost savings, job creation, I mentioned improving the well-being of employees and also people, the residents that use your spaces. So there's a lot of different things that this plan can support, other co-benefits that can be realized by implementing this plan. And of course, providing better value for money to taxpayers. So, a plan overview. So, the plan includes a history of your energy consumption and emissions and your current status. It includes the building audits and the Green Fleet Plan. Both of those documents were conducted before this plan was created, and then the input from those was folded into the plan, the building audits in particular. It was then reviewed by the Corporate Climate Action Team and the Senior Management Team. Then we modeled projections of future emissions and energy consumption. We looked at what are the priority actions going to be. We came up with emission reduction targets, and then provided estimates of savings, both greenhouse gas savings and, again, energy expenditure reductions as well. So, some of the highlights. Again, so there are 15 priority actions, and we're going to go through all of those, but quite briefly. They're in the following categories: new buildings, existing buildings and infrastructure, renewable energy, transportation, climate adaptation, and then we have a little other category as well, which covers things like waste, water, and natural assets. So you'll remember from your community plan, your CERP, C-E-E-R-P. So in the table, you'll remember there were some greenhouse gas reduction targets that were in that plan. So I've included those in this slide. And the new targets from your corporate plan, the CEEMP, are included to the right in this table. So you can see how they compare your community targets versus the corporate targets. So you can see we have 2025, 2030, 2050, and we have 18% reduction in community emissions, then 30% by 2030, 80% by 2050. So we've gone for some pretty similar targets in your corporate operations, just slightly more, slightly stronger, which for the Partners for Climate Protection Program, you need to be, at least as tough as your community targets is what they would like to see, because you need to demonstrate, they would like the community to demonstrate leadership. And also we have, a higher degree of confidence because you have so much control over your own assets versus what residents and businesses do in your community. We have a higher degree of confidence that you can meet these targets as well. So it is, because it is a very pragmatic plan. The plan also includes recommendations on ways to implement the plan and monitor progress as well. And so you'll see all of that in the plan. Okay, so your greenhouse gas emissions, as you can see from 2012 to 2018, I mentioned that they're below your all-time high. So your all-time high was in 2013. But you can see how it changes over time. And your natural gas consumption has decreased, and that's the primary reason that your greenhouse gas emissions are below your all-time high, but they're generally fluctuating within a pretty narrow threshold. We have fluctuations because there's changes in weather. You know, some years are warmer than others, colder than others, because there's changes in how buildings are operated in any given year. You might do more snow plowing in one year versus another. Those are the reasons for fluctuations, and just people being people as well, in terms of the operations of buildings and just randomness. So there's a number of things, but we can drive these emissions down. And that, of course, is what the district is going to do. I should perhaps highlight, so with respect to how the inventory is calculated, so we use the province of BC's methodology, which is what they would like communities to use for reporting their corporate carbon footprints. And this is the same as what's in the Clean Government Reporting Tool. But it's worth mentioning that, and this was something which was kind of stop press. So in November or December of last year, we got official notice from the province of BC that going forward, the electricity emission factor is actually going to increase. So it's going to be about 11 times greater than you see here. So although it's still, your electricity emissions are still going to be extremely low, but they're going to be about 11 times greater. But again, that's going to fluctuate year by year. And the reason is because before they didn't include imports of fossil fuel generation from outside of BC. We're still going to have a lower emission factor than Ontario, for example, or a lot of other parts of the world, much lower, but it's just going to be higher than it currently is. And that will take effect in June of next year. Okay, so your corporate inventory. So we can also split up your inventory by various, what they call the CARP classifications. So this is just how the province likes to split up your corporate operations. So in terms of the traditional categories of service that a municipality has. And I'm just going to highlight what your top three are for emissions and energy expenditures. So, you know, with each of these categories for 2018, we split these between gigajoules, energy consumption, tons of CO2 equivalent, and also dollars, energy expenditures. And so you can see, I mean, obviously we don't necessarily really care about gigajoules because it's a very abstract concept for most of us. But we do care about the environmental footprint, and we do care about energy expenditures, of course. And so you can see roads and traffic operations are our biggest energy source of energy expenditures. Then our next biggest is drinking, storm and wastewater, and then arts, rec, and cultural services. But our biggest source of greenhouse gas emissions is arts, rec, and cultural services, followed then by roads and traffic operations, and followed by drinking, storm and wastewater. But the top three are those categories, no matter what you look at. So one other thing I want to bring out here as well is that with drinking, storm, and wastewater, the reason that your energy expenditures are so much higher than the emissions in this category is basically because there's a lot of electricity consumption in this category. And that has a very low greenhouse gas footprint, but relatively high expenditures. Okay, so I mentioned your rising energy prices and how your energy expenditures are at an all-time high. So they, as you can see, 2018, roughly $1.2 million spent on energy. About 800,000 of that is from electricity, as you can see. And then the rest is split between the others. You can see a little bit for natural gas because that's a relatively cheap fuel. And then we have gasoline, diesel, and propane. And you can see that roughly 20% increase compared to 2012. I personally find this an extremely interesting slide. And it's interesting to see that your electricity expenditures, for example, are almost have almost increased every single year. There is a small decrease in between 2017 and 2018, but almost every year your electricity costs are greater. And in fact, almost every year, it's almost guaranteed that your energy costs are going to be greater than the year before. Not quite. You can see, for example, 2014 to 2016 as a sort of a narrow decrease there. But anyway, you get the idea. And it's very interesting. It just helps to emphasize the importance of trying to keep energy costs under control. Okay, so the recommended actions, which I'll just, I'm going to run through these one by one. These are in the report, of course, and but I will be brief in running through these one by one. So as I mentioned, there's 15 actions in these different categories. So new buildings 1, or MB1, is about building energy efficient and resilient facilities and buildings. So, building new things to be as energy efficient as possible. Then we have optimizing the siting and orientation of those new buildings. That's NB2. So that's just a simple way to try to make sure that we try to reduce the greenhouse gas emissions through those aspects. NB3 is including renewable energy in new construction major renovations, especially things like air source heat pumps or other forms of low carbon heating. EBI1 is to complete building energy improvements identified by the energy audits. You can see that is the single biggest action in terms of greenhouse gas emission reductions. And that's also the action we probably have the most confidence in as well, in terms of the estimated impacts, because of the work that was done by the building auditors. EBI2 is incorporating energy management into annual building maintenance procedures. EBI3 is conducting a low carbon resilience, that's what LCR stands for, focused review of infrastructure, including energy assessments and climate risks. RE1 and RE2, both RE1 and RE2, they're about looking at your other renewable energy opportunities, which can of course support the utility. RE1 is about hydroelectricity. Of course, you have a number of dams as corporate assets, and you might have some opportunities there. And RE2 is about looking at anaerobic digestion and wastewater treatment plant. But the reason we haven't got any greenhouse gas savings for these is just because we don't know if they're possible. We have no idea. So that's why there's no impact given. T1 is about implementing consolidated fleet actions. So that's basically following on the recommendations from the fleet report that was done. T2 is reducing emissions associated with staff commuting to work. We do have an assessment for a number in the plan on that. It's quite a small number. We do have an assessment for that, but it wouldn't be against your corporate operations. It would actually be a community reduction. Hence, we haven't included it in this table here. A1 is just about adaptation, assessing district readiness for climate impacts. O1 is about improving emissions reporting process. O2 is about managing district water consumption. O3 is about managing the waste creation. So for example, at the rec center and also at the district office as well. O4 is about looking at natural assets, developing a natural asset inventory and expanding the evaluation of nature-based solutions for infrastructure projects. This is something that more and more communities are interested in. And Gibson's, for example, have done some great pioneering work in this. And then this next slide is something which is quite an innovation for a corporate energy and emissions plan to have something like this particular table. This is the first appendix in the plan, and it basically provides an assessment of what if you implement your two biggest greenhouse gas saving actions, which are EBI1 and T1, and just tries to give an assessment of what the costs are going to be for the district in each budget year if you fully implement those actions. And I've never, we've been involved in dozens of plans, and this is the most detailed cost breakdown that I have ever seen in a corporate or community energy emissions plan. So I've been very, very proud to be part of this innovation with the district of Summerland, and it's something that we're trying to bring over to other communities as well. So it's very exciting for me to see the greenhouse gas savings for each of these different initiatives in different buildings. The different estimates of savings, the different estimate. I mean, of course, we only have this level of detail for the buildings actions, but not the fleet actions. But anyway, it's very interesting. I'm going to skip over to the next slide, if that's okay. And then we have estimates of, if we implement the plan, then projecting forwards what kind of impacts this is going to have for the district's greenhouse gas footprint going forward. And of course, this is an estimate. It's it's difficult to make predictions, very difficult to make predictions about the future. But this is roughly, we have the inventory years in here, 2012 to 2018, and then we have what we think is going to happen going forward. And it's we think that your emissions will decrease. Well, they will decrease as a result of implementing this plan and as a result of provincial and federal policies that come into effect as well, because all of those will combine to assist with those reductions. We've also included actually the impacts of a changing climate and how warmer winters will mean that you won't have to heat your buildings as much. And so that has an impact as well in terms of your natural gas consumption. But you can still see if you look further out what your emissions are primarily going to be. And so 2050 at the moment, we think probably about 50% of your emissions will be natural gas at these kinds of trends, and then the rest will be from gasoline and diesel primarily, as you can see. But we also think you should be able to hit your targets as well through the implementation of this pragmatic plan. Planned cost savings. Again, this is one of the charts that I like to look at the most, given I personally have a very strong interest in trying to help communities save money. And so, as you can see, 2025, you can see the approximate increase in the cost savings you should see compared to business as usual. We do include projections for energy price increases in the business as usual, primarily for electricity, because that is what we've seen historically, and that's what we think we're going to see going forward. But we think we're pretty conservative in terms of our energy price increases. There's also savings in here for operations and maintenance as well, because we think this plan won't result in a need for additional staff capacity. So we're trying to be quite careful with that, and in fact should be able to reduce the need for staff time. So this is a lot of this actually is from the buildings actions and just reducing the need for staff time on some of the buildings components. Even so, you can see we think that by 2025, of the roughly $230,000 a year that should be saved compared to business as usual, about half of that will be from electricity, which is something else I find very interesting. And it's also worth mentioning, and so something that, I would have this question if our roles were reversed, but why are we going to be considering electrification of vehicles if so much of our energy costs are from electricity? And the answer to that is because essentially because electric vehicles are so much more efficient than internal combustion engine vehicles. So an internal combustion engine vehicle is roughly about 20% efficient, maybe even a little bit less. And an electric vehicle is roughly about 80% efficient, so roughly 4 times as efficient. I mean, if you could imagine what it would be like going from a furnace that was only 20% efficient in your house to an 80% efficient furnace, of course, I'm sure most of you have, much better furnaces than that. But it just helps to give a sense of, well, it's going to obviously save a lot. So the next steps, council is currently receiving this report for information. So the next step will be council will consider the adoption of the CEMP, then submit the CERP, both the community plan, which you adopted last year, and this new corporate plan to the FCM ICLEI Partners for Climate Protection Program. That's something that we would do for you. It's very easy for us to do. There's no cost to the district in doing that. All of this has been, planned from the beginning, and it was very easy to plan for. Then further incorporation of these items into staff work plans and 5-year capital budgets. And there's regular report backs on progress. And then the other piece is looking more carefully at the adaptation piece that I mentioned before, the risk and vulnerability assessment and adaptation plan. And with that, we have questions and discussion. And I'm happy to stop sharing my screen whenever you like, just let me know.
Thank you, Peter. Council, questions? So feel free to ask questions of Peter or Dale or Tammy. Okay, I have one question, and it's really just for clarification, Peter. I think I wrote it down right, but I'm not sure. I think you said that towards the end of last year, so 2020, the BC government said that the calculation for electrical emissions, carbon emissions, was going to change, and that the change would take effect in June of 2022. And it was going to be 11 times. Did you say that?
That is correct. Yeah. So it hasn't taken effect yet.
Right.
It's gosh, there's quite a lot that can be said about it. What I think I'm going to do, if it's okay, is I'm going to share my screen, because we did include this in the plan, but we included it as one of the appendices because it's going to impact some of the considerations going forward. It actually doesn't have a huge impact. I mean, it's one of those things which is important to consider, but it actually doesn't have a huge impact. I mean, you're still going to have extremely low greenhouse gas emissions. But what I'm going to do is I'm going to share my screen just so we can see this part of the appendix. So this is on page 69, and so anyway, so this information was received in December and January, and will be effective in the 2021 year. They are going to back calculate as well, and so your current emissions factor under the old methodology is 2.587 tons of CO2 per gigawatt hour in 2018, but it's going to go up to about 29.9. Now, if that 29 year is going to be comparable to the 2018 year, so anyway, so that's roughly an 11.6 times increase. So but despite this, you're still going to have very low greenhouse gas emissions per unit of electricity. So I've given a couple of examples in the report. So for example, about 30 times lower than Australia's electricity, for example, 8 times lower than New York's, or 40% lower than Ontario's. So the impact it'll have to your corporate greenhouse footprint is your electricity emissions would go up from 17 to 197 tons of CO2, or your emissions as a whole would have gone up from about 975 to 1,155, or 18%. Some of the kind of initial information we've received from the province as well, because they've done some initial work at back calculating, and I hope I'm not turning this short question into a long answer, but some of the electricity emissions factor will still be decreasing over time, and so it will look better in terms of your greenhouse gas calculation. So in terms of compared to your 2012 baseline compared to now, so the rate of decrease should actually be a little bit greater than it is now in terms of the decrease in greenhouse gas emissions we're seeing. So I hope I answered your question, and I hope I didn't ramble on for too long.
No, that's good. Thank you very much. It was that 11 times made, yeah.
But it won't take effect until 2022.
Yes.
Which is important. And so the province of BC, they're not even going to be including this in the 2019 BC. They produced this thing called the BC Methodological Guidance for Quantifying Greenhouse Gas Emissions. And so it won't even be in the 2019 version, but it should be in the version which should be coming out very soon. But it should be in the version that will come out in the next year. It should be in that version.
Thank you very much.
No problem.
Okay. Councillor Barkwell.
Thank you, Madam Mayor. For our consultants here, I've read that BC has got some sort of plan to import 100% certifiable clean energy. What do they call clean energy? And when is that going to happen?
Sorry, that the province of BC has a plan to import 100% clean energy.
Yeah, I was reading something on, I haven't had time to sort of follow it up, but I presume that you're involved and you would know about it.
I'm going to see if Dale is aware of.
We can contact our the relevant staff in the provincial government and get back to you with any further detail on that.
It was in the mainstream media or something, and because they were people were objecting, and you know, that although we import and export both, that anything that came from uncertified clean energy, and that seems like a very broad kind of a statement, which might have some wiggle room in it. And I wondered if you were familiar with it. It doesn't sound like you're familiar at all. It surprises me because it's been in the popular press.
There's a lot of moving parts right now with electricity and energy overall in BC, including BC Hydro's integrated resource plan, which is currently underway, and the government's phase 2 review of BC Hydro, which should be out anytime now. And those things will, I think, significantly influence the direction that emissions take, because with the IRP, the integrated resource plan, hydro is looking out over 20, 30, 40 years on the demand for electricity, including for electric vehicles and fuel switching in buildings and things like that. And so there's a lot of moving parts right now.
I'll do a little bit of searching myself. I'm just kind of curious about it. Thanks.
Councillor Van Elfen.
Thank you, Madam Mayor. Just, I don't know if this is an appropriate time, but if I could ask Tammy, in our green fleet policy, we've gone through 2 budget cycles now, and we've added the 1 electric Zamboni. Are we, this time around, are we looking at, you know, the SUVs that we looked at during budget and pickup trucks? Are we going to go with electric and possible hybrids? Thank you.
Graham?
Yeah, let me just jump in on that, if I may, Madam Mayor. Thank you. And certainly, Tammy, you might want to follow up. But I have led recent discussions with our public works folks and the fleet managers, and we are looking right now for this budget cycle at even doing 3 vehicles to electric vehicles. A focus on that is in particular those vehicles that are also being utilized by staff. And so our planning continues in that regard. As you know, there's a big influx of manufacturer EVs coming into the market in the next few years. So we're quite excited about that. But we absolutely want to see our own green fleet here in the district, and we've been moving quite aggressively in that regard. In fact, I just had a meeting the other day with their public works director, Chris Johnson, who's also, I see, on the call today. But Tammy, do you want to follow up on that?
Thanks, CEO Stat, and thank you, Councillor Van Elfen. Basically just echoing what you just heard, that staff have heard from council that this is a high priority for you. And so you'll see in the plan that under 2021 for the fleet actions, we're trying to move quite aggressively towards greening the fleet and spending this year as a priority action to get those plans together to move forward with that as quickly as possible. But not even waiting for that and looking at some of these short-term immediate wins of revisiting this year's budget and looking for at least 3 opportunities to immediately electrify.
Good, that's great. Any other questions? Okay, so we have a recommendation to receive this report for information. Could I have someone bring forward that, please? Councillor Traynor, seconder. Councillor Holmes, thank you, you too. Any further discussion on this that's on the floor? Okay, all in favor? Any opposed? Okay, that carries unanimously. Thank you so much, Peter. It's good to see you again. Tammy and Dale, and the work that you've done on this, thank you very much. It's good, great presentation. And we're almost back on time too, so that's even better. Thank you so much. Okay, so now we're on to item 7.3, bylaw enforcement officer appointments. And Brad, just getting connected. There we go. Over to you, Brad.
Great, you guys are quick. Basically, what we're looking for today is the appointment of the 2 bylaw enforcement officers. for the District of Summerland. Council is aware we've hired a new full-time bylaw enforcement officer. His name's Dan Maya, and we're very happy to have Dan on board. But in order for him to do his job under the community charter, he needs to get appointed by council to issue tickets. So that's first order of business. And then also we are temporarily having Darren Krell in our bylaw enforcement team right now from the Parks Department to helping out with the bylaw enforcement side of things. So we'd like to also appoint Darren at the same time and allow both our officers working in the bylaw enforcement area to issue tickets on behalf of the district.
Thank you, Brad. Council, any questions on this? Bit of a housekeeping thing. Councillor Van Elfen.
Thank you, Madam Mayor. Not really a question, but just through to our Director of Planning. Because of the situation we're in with these horrifying Zoom meetings, will you maybe bring him to the next meeting so you could introduce him to us? Because a lot of us aren't going into City Hall on a daily basis. So it'd really be nice to meet the new fellow. Thank you.
Thank you, Councillor Van Alphen, and through the mayor to answer that. Yeah, actually, we have targeted the next meeting, March 8th, to bring forward our bylaw enforcement procedures policy. If council members, that was something that we presented back in, I think it was October last year, for your information purposes, and we thought it was an opportune time to get Dan's involvement, first of all, with that procedure policy, but then also, introduce himself to council at that meeting at the same time. So that should be coming forward at the next meeting.
Good. Thank you. Any other questions of Brad? Okay, could I have somebody move their recommendation, please? Councillor Van Elfen.
Thank you, Madam Mayor, that Dan Madja be appointed as bylaw enforcement officer for the purpose of enforcing the District of Summerland's bylaws, and that Darren Krell be appointed bylaw enforcement officer for the purpose of enforcing the District of Summerland bylaws.
Good, thank you, Councillor Van Elfen. Seconded by Councillor Traynor. Any further discussion? All in favor? Any opposed? Great, that carries. Council, we have a, thank you, Brad. Council, we have a break. Well, we're a bit behind. How about if we get back at it at 3 o'clock? Does that sound good? Okay, see you at 3.